Hello, my name is Joanne Sargent, and welcome to Choose Health. Today is May 5th, 2020, and what we find ourselves going through right now is nothing short of difficult. We've had to learn new ways to communicate with family, friends, and importantly, new ways in how we take care of ourselves. Today, I have a very special guest. Her name is Balan. She is the manager of a boutique med spa in Chelmsford, Mass. Called Begin with Skin. So welcome, Nina.
Hi, Joanne. Good morning.
Good morning. So Nina, I know you've had a lot of interest during this time where people have had to be at home more about self-care. And there's the emotional part of self-care, but then there's the physical part. How do people actually get their head around how to take themselves seriously and take care of themselves when they're in their homes?
Well, I think we're all struggling with it. Self-care from our mind, body, our skin. I think that especially with the stressful times that we're under, it can wreak havoc on all those areas. So taking time each day to exercise, family meal planning times, if you can do that, time to read, time to relax, and taking that extra self-care time for your skin and your skincare routine.
That's great. And I know a lot of people have reached out to you during this difficult time. And one of the questions they ask you is, just what are the reasons why my skin is aging so much? What do you say to them?
Well, stress, number one, those cortisol levels when we're under enormous stress get elevated, and it can cause all sorts of skin issues from breakouts, etc. However, the biggest culprit in our aging and photo aging of our skin is from the sun. So how do we deal with the sun? We have UVA, UVB rays that come down. UVA, I'd like to say, is aging rays. UVB rays are shorter rays that tend to burn our skin. So what we need to do is protect ourselves from the sun. That is the first and foremost for prevention of aging issues and sun damage. So too much sun, you get pigment changes, texture changes, and possibly skin cancer. Each year, about 2 million people are seen and treated for skin cancer. So that is the first cause of aging in the skin that we can work on preventing.
So you're an esthetician. Basically, what does that mean in terms of how you take care of people?
So an esthetician, we consider ourselves as skin therapists. So as a skin therapist, our job is to help coach you and treat your skin and educate you on the best ways to take care of your skin in the long term. Certainly, there's treatments we can do in the short term that help get your skin looking fresh and healthy, but also we're here to help coach and guide you for the longer haul of treating your skin and looking good as years pass.
And I know a lot of people have said to you, as part of all that's going on right now, I'm home, there isn't really much I can do. Is there anything I can do in my home to slow down the aging process?
Well, there's things that we can do, lifestyle changes, for example. So, the first thing, smoking and alcohol consumption. Those are two things that people do that do wreak havoc on the skin. Alcohol tends to dehydrate the skin, and it can dilate your blood vessels. And sustained use of alcohol can also increase your blood sugar, which increases overall inflammation. So reducing our alcohol consumption is always a positive thing for your skin when you're at home, and reducing your smoking. Smoking actually asphyxiates the skin, and it weakens the blood vessels and the blood flow. So it makes your skin look dull and gray. So less smoking, less alcohol are two really good things that we can do at home, as well as getting on a good skincare routine and program.
I know a lot of people over the years spend time taking care of their hair and their nails, and sometimes skincare, stepping it up a few notches by coming to a facility that can do some really good clinical facials, is not something that people always think about. But I know myself recently, I had a VI peel, and
Mhm.
I was amazed at really how well it worked. Tell me a little bit about why that was a good thing for me to do.
Okay. Well, a VI peel is a medium depth peel, which helps to exfoliate at the deeper levels of the skin. So it helps to pull up pigment, even out skin tone, lighten and brighten the skin. So when we talk about sun damage and photo aging, the majority of the aging, 25% of the sun damage we get happens before the age of 18. The additional amount of damage we get, 80% of our sun exposure is incidental, which means we're going to CVS, we're walking into the grocery store, walking our dog. All that incidental sun works on breaking down those skin cells, causing free radicals, and creating sun damage. So when you get a peel, what it does is help rejuvenate, remove all those dead skin cells, and we see brighter, fresher skin underneath. But to that point, also, as we get older, that cellular turnover process, it's called the keratinization process, that tends to slow down. So by doing peels and using products that do help exfoliate the skin on a regular basis, we're keeping that fresher look, that newer skin on the surface of our face when we can see and we look brighter.
Great. And I know if somebody decided that maybe a VI peel is new to them or they wanted to go in a different direction, what
Mhm.
kind of facials do you recommend people really consider getting?
Okay. Well, at Begin with Skin, typically we encourage clients to come in and we do a very thorough consultation, health history. I ask clients to bring in the skincare products that they're currently using. And we go through in detail about their history, about what they're currently using, and their goals for their skin. What is it they're looking to accomplish? And based on that, then we decide what services would best treat the conditions that they're looking for. So here at Begin with Skin, we offer Hydrofacial MD, which is a facial that uses Vortex technology that helps to infuse antioxidants and anti-aging serums into the skin while extracting impurities. So in addition to that, we also do clinical facials um, using a skincare line called Environ, which we do like very much and see nice differences in client skin using Environ. And with our clinical facials, those tend to follow a more traditional facial with some steam and extraction, light peeling. So, and then on top of that, we also do microneedling and other treatments to also help combat signs of aging. So it
So,
really depends on what the needs are and what we're looking to treat.
sure. I know people too will call up and they'll ask you to do a microdermabrasion treatment, but that doesn't seem to be the newer technology. Is that correct?
So microdermabrasion has been around for a long time, and typically microdermabrasion uses aluminum oxide crystals to kind of abrade the surface of the skin. Hydrofacial is as efficient, if not more efficient than microdermabrasion. It uses a chemical exfoliation and the vortex, which kind of pushes and pulls at the same time. So you get a better result using a hydrofacial than you do a microdermabrasion.
Great. And I know that while the majority of people might think that these types of treatments are more for women, you do see teenage boys and men who have skin issues as well. And share with me why that's important for them to think about that.
So we do have a lot of teen clients that do come in as well as men, and their skin as can have the same issues as women. We see dryness, we see acne, we see rosacea in men and teens. And it's important that they come in and care for their skin. I look at it as, you know, you wear your skin your whole life, and it's better to prevent and treat the skin at an earlier age than it is to try and correct at a later age. So the sooner we start treating our skin well, we can have many years of very healthy skin.
That's great advice. And as we are approaching the summer months, of course, I think you're a big advocate, and you mentioned it earlier about sunscreen. What are some of the important things people need to think about? I know for myself personally, the first thing I do is I check expiration date. It's amazing how quickly they expire, but what are some
Do.
things we want to think about?
So with sunscreen, I suggest every year going through your sunscreens, looking at expiration dates, first of all. They can, be expired, and you don't want to be putting an expired sun product onto your skin. But wearing sunscreen every day, rain or shine, is going to prevent that photo damage that happens that causes wrinkles and fine lines and skin cancers. So incorporating wearing sunscreen as part of your daily routine. So you wake up, you cleanse your skin, you put on your moisturizers, and then you put your sunscreen on top. So for women, sunscreen can also be built into their foundation or any sort of makeup they put on. But I always do suggest wearing an additional sunscreen in addition to their makeup. When you look at sunscreen, when it says SPF 15, SPF 30, SPF 50, that is really just the burn time. So an SPF 15, it takes 15 times as long to burn. An SPF 30 takes 30 times as long to burn. So finding an SPF that works for you, I always suggest an SPF of 30 or higher, and you do need to reapply every few hours if you're going to be outside.
And the other thing that is related to the summer months, and maybe you can share your opinion on this, but let's say somebody says, I've always wanted to have laser hair removal treatments done on my legs or under my arms. Is it true, or what can you suggest would be the best time frame for people to consider having that done as we're approaching the summer months?
Unfortunately, I wouldn't suggest doing laser hair in the summer, specifically because the laser is attracted to pigment. So it's attracted to the pigment in the hair, and it's also attracted to the pigment in the skin. So we do ask that when you get laser hair removal, you do not have a tan. So I would say the fall, anytime from the fall until the spring, but in the heart of the summer, doing hair removal may not be the best way to go for safety reasons.
Right. And I know that while your facility has been closed, you've been getting emails and phone calls about skincare. Tell me a little bit about the skincare products that you use either on yourself or that you suggest for some clients. I know there's so many different brands out there, and what you offer isn't something that you can just walk into a drugstore and purchase.
Oh, so we offer a line called Environ. It's a global brand that's been around for about 30 years. It is a medical grade line created by a plastic surgeon, Dr. Des Fernandez, and he is based out of South Africa. And he created the line specifically because he was seeing so much skin cancer in his community. So the line is actually a vitamin A based line, which means that vitamin A is an antioxidant that is very good for the skin, to normalize the skin, to control oil, to improve cellular turnover. And it does also help promote the formation of collagen and elastin in the skin. So we customize your skincare routine here at Begin with Skin with Environ based on, again, what your skin's needs are, where your skin is now, where we need to go. And then we design a skincare program that will fit best for you. Environ cannot be purchased online. It can only be purchased through medical spas that do carry Environ.
Great. And this is, as I said before, a tough time for a lot of people. They're home. Maybe they're on unemployment, so finances are certainly of concern. Is there anything that you folks are doing to try and just give people a little something when this is all over?
Well, so we do offer virtual consults if someone is certainly interested in finding out what to do for their skin and they just need a little pick-me-up. We do have products that we can send out to clients, and sometimes if they're local, we will drop them at their door wearing our masks and our gloves, or also curbside pickup. We have that available. But I think for people who are home, I think you need to simplify your skincare routine and go back to basics. Cleanse your skin, Don't forget about using a face cloth. That adds a little extra exfoliation. You don't need to scrub your skin, but using a face cloth adds, with a little light pressure, kind of helps with that cellular turnover. Use a serum, serum best for your skin type, whether it's hyaluronic acid if you have very dry skin, or a vitamin A, an antioxidant serum, moisturizer, and sunscreen. Keep it very simple. And then you can certainly exfoliate once a week with a mask, a special mask, but still be gentle with your skin. We don't want to over scrub and over treat our skin, but we do have a series of products here at Begin With Skin that we can certainly help any clients and our current clients find what's best for them.
Great. And shifting for a moment, I noticed that you have a sign behind you where Brooke Shields is the new spokesmodel for a product called Sculpture. And
Yes.
everybody's been joking, saying that, they don't know what to do first. Go see a counselor or go see, go on Weight Watchers. But for example, tell me a little bit about Sculpture, to the best of your knowledge, about what that could help for some people who are realizing that they may be struggling with some overeating while they're being home on this social distancing.
So in the ideal world, we're eating well, we're exercising. However, there are always those fat pockets on our body that, despite exercising and working really hard, that we just can't target. So that's where Sculpture comes in. So Sculpture uses a warm heat technology that actually helps to melt fat in certain areas of the body, up to 20 to 25% of fat in a certain area. It's a very comfortable treatment. It's 30 minutes. There's no downtime. And it's really for those clients that have those areas. It could be fat around the bra line, the love handles that you just can't seem to shift. And one or two treatments of Sculpture, we get a really nice result, a very natural result. And it's a nice enhancement to people who are trying to just reach those goals that they just can't seem to get to with diet and exercise alone.
Thank you. And you alluded to it a little while ago, but now that people are starting to think that sooner than later they may be able to go out of their homes and seek services that they haven't, can you share with me a little bit about what you're doing at your med spa to make clients feel safe when they decide to come back?
So we've spent a lot of time as a team talking about safety measures for our clients, patients coming back to Begin With Skin. And we've always taken very high sanitation, disinfection measures anyway. However, our biggest concern is to have clients feel comfortable when they come in here, and we're going to start limiting how many clients come through at any given time. So, masks, gloves, I'm sorry, Joanne. Mask, gloves. We want to limit the number of people in our waiting area at any given time. We will ask clients to, when they come to the spa for their appointment, to call us from their car to let us know that they're here. And then our receptionist will let them know when to come in, so to avoid too many people crossing paths at the same time. So we're making modifications within the business to make clients feel more comfortable and safe coming here.
Yes, I think that's important. I think that it's a two-way street. So with the changes that Governor Baker has implemented effective tomorrow, wearing masks, I think people need to come in and feel comfortable that you're providing a healthy and safe environment. And likewise, we want people to be, I'm sure, respectful when they come to see you, that they're also following the same precautions.
It's definitely a new normal. I don't think, this is a business where we like to nurture our clients. We have a very personal relationship with them. We see them, hug hello. We're very involved. We've seen them for years in their life. And it does feel, awkward not to be able to do those things. But for now, this is safe for everybody. So we're going to take all those necessary steps to make sure our clients' safety and our staff are safe upon opening. And, this won't last forever. And as rules and regulations change and we move along, we will probably be able to loosen some of those guidelines as we go.
Thank you. So of all the treatments that you can perform, and I'm sure you've indulged in a few yourself, what is your favorite treatment that you
I've done or have tried?
done or tried?
I have tried them all, and I think they all have their place. I certainly love a VI peel that gives a nice bright look to the skin. I love my hydrofacials. That's an immediate gratification on how your skin looks, and your skin really sees a difference up to 3 weeks post-treatment with that. Microneedling is excellent for tightening and rejuvenating the skin. I love that. And Ultherapy is another treatment that we have here at Begin With Skin, which is excellent for clients looking to tighten and tone the skin in a non-invasive way.
Great. So if someone had a question or concerns and they weren't quite ready yet to physically come in, you mentioned virtual consults. I suppose that's new in this world, but does that work quite well?
So virtual consults, we have a program that we basically very similar to what we're doing here with Zoom, that we can do a virtual consult. It's not like seeing someone in person where we can look and touch and feel their skin. However, we go through a series of questions with our clients, just like we would in a personal consultation. And they can email us at beginwithskinmedspa@gmail.com or on our website, beginwithskinmedspa.com, under our contact us. And you could request a virtual consult and we will get back to you to schedule a time to virtually see you. So
No, that's great. I think it's just another way of allowing you and your staff to connect with people out there, whether they have questions or whether they want to purchase something or just in general. I know that as you are doing your job as an esthetician and you see people, I know that you have a strong relationship with, for example, local dermatologists. It's not uncommon, is it, for you to see something, be a little bit concerned about it, and possibly refer them to their dermatologist?
it's very important as part of your skin health and your lifestyle that you do have a dermatologist that you trust and you go to for annual skin screenings. That's very important. Certainly, if we are not doctors and we can't diagnose anything. However, if we do see something that we feel should be looked at, we certainly give the recommendation to do that and encourage our clients to get it looked at.
Yes, I've heard from other estheticians and even from estheticians in your practice that they've seen something, they weren't really quite sure what it was, and they referred to a dermatologist, and then they called you and thanked you and said, I have basal cell carcinoma on my face. Thank you so much for pointing it out. And I think those types of screenings that you do are very important.
Well, we see a lot of skin every day. So, we can recognize things that don't look right. But even for your own skin, when you check your body, you can do your own skin scan. And, if you see something that doesn't look like the others, it's kind of the ugly duckling on your skin. If something stands out to you and is, changing, you haven't seen it before, it might be bleeding or it's itchy or something unusual, then certainly reach out to your dermatologist. It's worth being cautious and having things checked out.
Thank you. Well, you have given us so much information today. I think partly information that tells us that for the next several weeks, how we should be taking care of ourselves and the things that we should be thinking about as the summer months are approaching. And, self-examination, making sure that if we see something that looks like an ugly duckling, that we report that when necessary. And it's been very helpful. I think that you're all anxious, I'm sure, to get back to work and reconnect with your clients who you've formed, as you said, special relationships with. And I'm sure that once the whole state is able to move in the direction of reopening, that people will be happy to see you.
Well, we certainly look forward to seeing them too. And we just, in the meantime, wear your sunscreen, stay hydrated, and just take care of yourself in the meantime.
Well, thank you very much. And again, I appreciate your time today, your expertise, your knowledge, and it's been my pleasure to have this chat with you today. And again, I appreciate your time, and stay safe, do what you're supposed to do, and we will hopefully see you after the 18th when we're allowed to open up.
I hope so. You too, Joanne. Thank you.
Thanks, Nina.
Bye-bye.
So I want to thank everybody for tuning in today. This is certainly a different way of doing things, but I appreciate everyone's attention. And I also appreciate, again, Nina sharing her valuable information with us. But as a nurse, one of the things I did want to say is that May used to be one day designated to nurses. But of course, there's nothing that says what has been going on in this community over the past many months. And I wanted to give a shout out to all of the nurses who are not only working front lines, those of you taking care of your families, your communities, and just being a resource to all your friends and families, and even nurses that are helping the employers in this state. I want to say thank you. I appreciate all your hard work. And to the nurses out into the whole nation, if you will, I want to say congratulations for your hard work. Stay safe, and happy Nurses Month.